and why you need to get screened and wear sunscreen. Also, that's a lot of screens. Today I'm discussing this topic because I myself am a skin cancer survivor. It sounds very dramatic. It wasn't that bad for myself, but it was a very scary endeavor. I'd like to tell you a quick story. I am a 37-year-old woman, and for approximately 30 years of my life, I have not worn sunscreen. This is because I have always been the bronzed goddess, very obsessed with her tan. And that was more important to me than the concern of skin cancer. Skin cancer to me was always just the far away thought. It was a maybe. About a year ago, I had a small mole appear right here at my hairline. It looked like a normal mole. I have them on my body. It didn't seem like anything to worry about. It did not fit any criteria that would have had me concerned, except it started to grow larger over time. After about a year, I decided to make an appointment with a dermatologist, and even the dermatologist agreed, stating, "I don't think this is anything to worry about." Approximately 3 days later, I got the phone call that I had basal cell carcinoma. And luckily for me, it's one of the most treatable skin cancers there is. But hearing the words, "you have cancer," is absolutely terrifying, even if it is highly treatable and curable. I had to undergo Mohs surgery, where they take off layers and layers of skin until they get clear margins to ensure that there are no remaining cancer cells. And this was, again, terrifying. My dermatologist even commented that it was so unusual that somebody as young as myself was already developing skin cancer, and now I have to go every 6 months to undergo screenings. Here is a couple visual aids of what skin cancer could look like. But as I said, it can also just look like a regular mole. Doesn't even seem like anything to worry about. And for myself, I didn't think it was anything to worry about. The dermatologist didn't think it was anything to worry about. According to the Skin Cancer Foundation, 1 in 5 Americans will develop skin cancer by the age of 70. More than 2 people die every hour from skin cancer. The risk of developing melanoma doubles if you receive 5 or more sunburns. And I think at this point, everyone has developed minimum 1 sunburn, probably several sunburns. According to the Skin Cancer Foundation, 9,500 people diagnosed with skin cancer daily, and there are more people diagnosed with skin cancer each year than all other cancers combined. That's a lot of people developing skin cancer. 90% of non-melanoma skin cancers are associated with UV radiation, meaning the sun. Basal cell carcinoma is the most common type of skin cancer, with 3.6 million cases diagnosed each year. There's squamous cell carcinoma, you can see right here, and this is the second most common skin cancer, with 1.8 million cases each year. And there are 212,000 cases of melanoma each year diagnosed in 2025 so far. Over the last 10 years, 42% increase in invasive melanoma has been diagnosed. With all of these different skin cancers, the average 5-year survival rate is 94% if it's caught early. Survival rate falls to 75% once the disease reaches the lymph nodes. The daily use of sunscreen SPF 15 or higher can reduce the risk of developing melanoma by 50%. For me, this was a huge number because all those years, if I had just worn sunscreen, I might have avoided having to undergo Mohs surgery. Men ages 15 to 39 are 55% more likely to develop melanoma than women of the same age. And 419,000 cases of skin cancer are linked to indoor tanning, with 245,000 of those being a basal cell carcinoma. 168,000 are associated with the squamous cell carcinoma, which is the second most common type, and 6,200 are melanoma. Indoor tanning, is awful for your skin. It is direct UV radiation, and oftentimes SPF sunscreen is not allowed to be worn with indoor tanning. More people develop skin cancer from indoor tanning than develop lung cancer from smoking. And this is all according to the Skin Cancer Foundation. Any history of indoor tanning increases risk of developing basal cell by age 40 by 69%. Skin cancer screening is a relatively easy process, and it's also relatively non-invasive. You make an appointment with a dermatologist and they do a head-to-toe assessment where they inspect your skin and check out any growths you may have. If anything looks mildly suspicious, they'll go ahead and numb the area with a local anesthetic, usually lidocaine. They'll remove it and send it off for testing. Anything that doesn't look very suspicious, they'll keep an eye on it and have you come in minimum once a year to recheck. For myself, like I said, I just went in because the mole was growing. Not even large, not excessively. I just noticed that it had been growing over the last year. And for myself, I felt that it was imperative to get it checked out just to be safe, because skin cancer does run in my family. Both my mother and my maternal grandfather have had melanoma. So I felt it was important for myself to go ahead and get checked out just in case. It's also imperative to begin wearing sunscreen daily. As I stated, even an SPF 15 can help reduce your risk of developing melanoma by 15%. Covering up when going outside, hats, long sleeves. I know it seems counterintuitive when it's hot outside to put on long sleeves, but that long sleeve shirt or that hat can help protect you from needing surgery, from having to undergo more invasive cancer treatments such as chemo, radiation, anything like that. Skin cancer is, if not preventable, then at least highly, it's not necessarily preventable, but you can do what you can to try to prevent it, to try to limit your chances of developing it. I myself have started wearing sunscreen, and I am now the person who chases my children around with a bottle of sunscreen, asking them, "Did you apply? Did you apply?" Making sure they wear long sleeve bathing suits, rash guards, hats, although it's hard to keep a hat on a 2-year-old at the pool, but I do my best. because I now understand the importance and the toll that it can take on your body from sunburns or from just moles. I would implore you to not be like me. Go through the steps. Wear the sunscreen. Make your friends wear this sunscreen. Make your kids wear your sunscreen, your partner, your parents, the teacher that's outside watching the kids. Remind them about the consequences that the sun can have on the skin and the potential for sunburns and resulting cancer diagnoses. Thank you so much for taking the time to listen to my story. I hope you all have a wonderful day.